Everybody, listen, if you're proud of your age, but you don't necessarily want to wear every line or wrinkle, who does? You should know about the effectiveness of the new neurotoxins. Well, Dr. Sam Shatkin is back from the Aesthetic Associates Center in Amherst with details. And to show you how easy it is to administer, he's brought along his nurse and good sport, Kathy. So good morning, folks.
Yeah.
Nice to have you here.
Talk about Great Look Monday, right?
Great Look Monday. Tell us about neurotoxins.
Well, the neurotoxins, most people understand them as Botox. They've been around for about 20 years. Actually, this is our 20th year doing neurotoxins in our office. And there are 3 or 4 available. We currently use 3 in our practice. Botox is the most popular, Dysport's another, and then the newest one, which really just came around about a year ago, is called Jeuveau. And they all pretty much are interchangeable, and they provide the same type of relaxation of the muscles.
Okay, and they are very effective. How long do they last?
Well, generally anywhere from 3 to 6 months.
Okay, all right.
Some patients get a little longer benefit from it.
And you can use them on different areas around the face?
Well, the FDA has approved them for the use in the glabella area, the frown lines between the eyebrows, and also the crow's feet we can use it on, but we use it for other areas. You know, we use it to help with a gummy smile on some individuals. Big smile, Kathy. See, she doesn't have a problem, but some people, when they smile, they get all the upper lip gummy.
Yeah.
So we use it for that. And you know, in our dental practice, we get a lot of referrals with Dr. Todd, his practice. We use it for TMJ injections too, for people with heavy grinding and bruxism. But generally, we use it for facial rejuvenation.
Okay, I like this because it's a very subtle improvement.
Well, not only is it subtle, but it's a very brief procedure.
Okay.
And we're going to demonstrate that in just a minute. And the other thing I want to mention, too, is that if you book your procedure today for a neurotoxin, any of the 3, they get anywhere from $50 to $100 off their treatment.
All right.
Book
Show
it today.
us how
Special.
This is done before
it's
we
March
run
Madness,
out of time.
Linda.
Yeah,
March
and
Madness.
You can see how easy
okay,
this
so I'm
would
going
be
to
for
show
you in the
Right,
office.
I'm going to show you how you do it. Go ahead and frown, Kathy. So in the office, we'll mark the areas that they are having the wrinkling and the movements. Okay, now squint down, Kathy. So she's got these crow's feet here. And we actually have a picture of Kathy somewhere from way back about 20 years ago when we had done her first injections. So we do the marking, and I like to mark it. It's sort of like
there it is.
paint by numbers. There's her picture, a little sideways picture, but that's okay. That's the before, and there's the after.
Wow.
So you can see dramatically. So every few months she comes back to me, and we go ahead and do the injections.
And we do it.
And I'm going to show you. I'm going to show you how brief it can be.
Okay.
All right. So what I do is I cleanse the area then with alcohol.
All right.
Which just takes a second.
Yeah, the whole thing just takes a second. Now, this takes about a day or so to...
Well, it takes anywhere from 3 to 5 days to start working, and then it reaches its peak at about 6 to 14 days.
Yeah, so as Kathy gets the injection, it will take a couple of days to see it, to actually see the result, but boy, when you do, you'll be smiling and with no lines.
It really relaxes the muscles.
Now, is there numbing agent in that?
No, but they don't need it.
Okay.
So in our practice, you know, my daughter has diabetes, Linda, we've talked about it. I use the insulin needles. You know, she used to give herself 6 or 7 shots a day, and if it was okay for a young child to get that, I figured, I'll use that on my patients. So I've been using these now. I think nationwide, almost everybody's adopted these tiny little needles.
And she's not even flinching, so really, it's
well, I pay her not to move.
Good way to do it. Yeah, you do
Just
a good
kidding.
job with that.
And then the last, so literally it doesn't take much longer than this. In fact, the length of time is a big part of it is the consultation when we have the patients come in for their first visit to discuss what they're going to have done. And this is basically how long it takes to do the treatment. And I'm finished.
Again, no surgical treatment required. This could be your answer. So, I mean, just think about how this really, there's no downtime. It's fantastic.
Okay, and I just want to give you the March Madness special. If you
one more time.
Call the office 839-1700 today and book it. It doesn't have to be booked today, but you have to book it today on an upcoming visit, and we will give you that anywhere from $50 to $100. We have different discounts for the different type of products that we have.
Looking good as usual. Dr. Shatkin, thank you so much. And don't forget the Trey Ray Spa right down the street. You can go right after you get your injections. It's all good. All right, everybody.
Thanks,
spend a little time on yourself, everyone, and do it via the wonderful Aesthetic Associates office right on Main Street. Right off, actually, on Kensington Avenue.
Kensington
right
Avenue
off of Main Street.
in Amherst.
In Amherst. All right, take a quick break. We'll be right back.